Welcome back to the Megalo Market. Some of you may recognize this little mom and pop store from our sketchy micro cytomegalovirus sketch. In that scene, we had a cans-only recycling bin off to the side to represent Ganciclovir. Well, as you'll see soon, Ganciclovir and the other agents used to treat CMV infections will take center stage this time. CMV infections occur primarily in the setting of advanced immunosuppression, typically due to reactivation of latent infection. Although the incidence of HIV-infected individuals has markedly decreased with the advent of potent antiretroviral therapy, clinical reactivation of CMV infection after organ transplantation is still prevalent. Oral Valganciclovir is commonly used for prophylaxis and treatment. And just like last time, let's sketch in our green cans-only recycling bin in order to emphasize that we're talking Ganciclovir here. Though other agents will be covered as well, including Cidofovir and Foscarnet, the returning fan favorites from our Hermes airline sketch. Let me get you into the exam mindset here. A man walks into the ER complaining of progressive visual impairment. He's non-compliant with his antiretroviral medications and his CD4 count is less than 50. This is the classic CMV scenario, which often includes an emphasis on CMV retinitis. The woman holding that likely preservative-ridden frozen pizza is highlighting the classic hemorrhages and infiltrates seen on examination of the retina. CMV infection can involve retinitis, esophagitis, and central nervous system involvement. And remember, on an exam, the scenario will likely involve a patient with CD4 counts less than 50, as represented by the 50 items or less sign. Convenient. All right, let's cover Ganciclovir's mechanism of action. Ganciclovir will be represented by cans, of course. See the display in the back of the store? I know what you're thinking. Those cans have a striking resemblance to nucleoside bases, right? Well, take a close look and you'll see that they're also labeled with a G, indicating that Ganciclovir is a guanosine analog. Sound familiar? Yep, it's just like the acyclovir luggage from our Hermes airline sketch, also a guanosine analog. The mechanism of action for Ganciclovir is largely the same. It gets phosphorylated 3 times before incorporating into viral DNA and getting jammed in the polymerase. And just like last time, we need a virally encoded phosphorylating enzyme to perform the first phosphorylation step. See Braden here? It's his first summer job, and already he's overwhelmed with his duties as the inventory guy, the classic entry-level position. I want to emphasize here that Ganciclovir is first converted into Ganciclovir monophosphate via CMV-encoded protein kinase. This is an important distinction because this contributes to its specificity for CMV-infected cells. The subsequent phosphorylation steps are then taken over by cellular enzymes. Well, our price checker here is marking the cans with a P sticker, representing that first phosphorylation step. Remember, because he is a cytomegalo employee, he represents a virus kinase, like the one produced by CMV. For the second and third phosphorylation step, let's sketch in 2 unruly kids going crazy with the price sticker guns. Notice that a second and third phosphorylation sticker are getting added to the cans. These punks represent the cellular kinases that eventually generate Ganciclovir triphosphate. Now a nucleotide analog, Ganciclovir can readily compete with deoxyguanosine triphosphate for viral DNA polymerase. That will be depicted here as their mom sends these triphosphate cans down the conveyor belt, and it looks like they're going to get into a jam at the junction, messing up the flow. This junction represents the viral DNA polymerase, just like at our Hermes airline. The single conveyor belt has a DNA helix design, which splits into 2 equal double-stranded helix paths, just like DNA-dependent DNA polymerase. When Ganciclovir triphosphate gets incorporated into replicating viral DNA synthesis is terminated. Remember that first virus-encoded kinase step. CMV can gain resistance to Ganciclovir from mutations in its protein kinase, resulting in decreased levels of its active form of Ganciclovir. We'll see this a little later. See that woman at the free samples tray in front of the store? Her appetite as insatiable as her outfit is inappropriately medieval themed? She will represent Valganciclovir, a prodrug of Ganciclovir with better oral bioavailability. Notice that the word value highlights Valganciclovir. And she is tossing one of the samples into her mouth in order to emphasize increased bioavailability, which is also indicated by the available sign with upward arrows. Valganciclovir is as effective as IV Ganciclovir for the treatment of CMV retinitis and is also indicated for the prevention of CMV disease in high-risk solid organ and bone marrow transplant recipients. Let's sketch in the meat department in the back with organs on ice, the recurring sketchy symbol for our organ or bone marrow transplant. Remember that IV Ganciclovir or oral Valganciclovir not only treats active disease, but can also be used to prevent clinical infection in immunocompromised patients. The adverse effects and resistance patterns of Valganciclovir are the same as those with Ganciclovir. The big one to remember on the exam is myelosuppression. Ganciclovir and Valganciclovir are associated with bone marrow suppression, particularly leukemia, which can usually be managed with hematopoietic growth factors. So we've changed the sample tray into the shape of a bone. And notice that Renaissance fair lady over here is gluttonously devouring the marrow. During Ganciclovir or Valganciclovir therapy, patients should be monitored for hematologic toxicity, and keep in mind that these effects may be additive in patients receiving concurrent administration of other myelotoxic agents such as Cidofovir, one of the NRTI agents used in treating HIV. Oh, I recognize her now. It's Isolde, representing Cidofovir from the Knights of the Round Table sketch. No wonder she's craving that marrow. All right, remember that cytomegalo employee marking the cans with a P sticker representing that first phosphorylation step? CMV can gain resistance to Ganciclovir through mutations in this protein kinase, resulting in decreased levels of the active form of Ganciclovir. However, there are a couple drugs to keep in mind, Foscarnet and Cidofovir, that do not require this first phosphorylation step and can be used to combat resistant strains of CMV. Foscarnet is a pyrophosphate analog that directly inhibits viral DNA polymerase without requiring activation by phosphorylation. Zooming past him, bypassing this kinase, is none other than that obnoxious kid in the Foscarnet. You may remember this Foscarnet kid wreaking havoc in our sketchy micro CMV sketch. Well, he's back. And notice that he's slamming directly into the DNA polymerase cache register, just like Foscarnet's ability to directly bind to DNA polymerase to halt DNA synthesis. Foscarnet is available IV to treat N-organ CMV disease, as well as resistant strains of HSV and VZV. In this scene, we're going to highlight the numerous electrolyte disturbances that can result from Foscarnet administration. First of all, see the barrel of kidney beans knocked over as the Foscarnet zooms by? This represents the renal insufficiency induced by Foscarnet. Foscarnet appears to be directly toxic to the renal tubular cells, though this renal impairment can be reversible in some. Hypocalcemia is another important adverse effect of Foscarnet, possibly via complex formation between the drug and free calcium. Let these dropping milk bottles flying out of the back of the Foscarnet represent this hypocalcemia. The electrolyte disturbances caused by this problem child don't stop there, however. Hypomagnesia is another common adverse effect of Foscarnet, as represented by this falling magnesium magnet display at the register. This hypomagnesia may contribute to the development of hypokalemia. So let's sketch in our recurring sketchy symbol for depleted potassium, banana peels, this time surrounding an upended produce display. An exam question may also highlight the possible seizures that result from these electrolyte disturbances. So let's draw in a few sketchy action lines to the Foscarnet kid as well. Okay, there's another drug used for resistant strains of CMV, and that's Cidofovir, represented again by Cid, the security officer. And while his day job is bringing a halt to resistant strains of HSV and VZV at Hermes Airlines, he works nights at the cytomegalo market. Notice that Cid is running past our cytomegalo price checker in order to put a stop to all the riffraff. That's because Cidofovir does not require the first phosphorylation by viral kinases before being activated by cellular enzymes. He has his own phosphorylation badge, of course, thus maintaining activity against kinase-deficient strains of CMV. Cidofovir directly inhibits viral DNA polymerase, depicted here as he pulls the shutoff switch, bringing a halt to the DNA conveyor belt. Because both Cidofovir and Foscarnet are acting directly on viral DNA polymerase, CMV strains can gain resistance through mutations of this polymerase. The primary adverse effect of IV Cidofovir is nephrotoxicity, leading to proteinuria, azotemia, and metabolic acidosis. And that's why we've sketched in some kidney-shaped merchandise toppling over as he runs to the cash register. Because of this risk for nephrotoxicity, IV Cidofovir must be administered with probenecid, a drug that blocks active tubular secretion of Cidofovir, thereby limiting its toxic effects. Probenecid will be represented by Cid, the probation officer. It's Cid's strangely homonymous twin brother, of course, who chose a slightly different line of work. To highlight the prevention of kidney damage, we've shown him preventing this display of strangely kidney-shaped beverages from toppling over. And just to further emphasize that probenecid is keeping Cidofovir out of the tubules, limiting its excretion by the kidney, think of Cid, the probation officer, as keeping this punk teenager away from the bottles of alcohol, away from the kidney, so he doesn't violate his probation. In fact, probenecid prevents the excretion and increases the plasma concentrations of many different drugs, including penicillins, methotrexate, and NSAIDs. Hence, the tattoo displaying our cashier's fondness for illicit substances. Oh man, but drugs are so cool. All right, let's sum up this sketch. Ganciclovir is a guanosine analog used to treat and prevent CMV infections. It's first phosphorylated by a viral protein kinase, as depicted by our megalo-market employee applying the first price sticker. Then cellular enzymes take over, leading to a triphosphate form that halts viral DNA polymerase. At the value samples tray, remember that Valganciclovir has increased oral bioavailability. The big side effect of acyclovir and valciclovir? Bone marrow suppression. The drugs Cidofovir and Foscarnet can bypass the first phosphorylation step and directly inhibit DNA polymerase. Therefore, they were effective in treating resistant strains. Foscarnet is associated with nephrotoxicity and numerous electrolyte disturbances, so watch out for seizures. Cidofovir, represented by Cid, the security officer, is also associated with nephrotoxicity. This adverse effect is limited by probenecid. Cid, the probation officer, who monitors offenders and keeps them away from the kidney. Remember, just say no to nephrotoxic drugs.